Welcome to the virtual Grand Rounds. My name is Rachel Bockel. I'm a first-year medical student at Geisinger Commonwealth School of Medicine in Pennsylvania, and I am this year's AADMD Virtual Grand Rounds facilitator. For those that are new, virtual Grand Rounds are a webinar-based presentation model that creates a space for mentorship and exchange of knowledge and experience between seasoned IDD providers, entry-level clinicians, and future healthcare providers in training. The purpose of the Grand Round sessions is to expand and strengthen the IDD healthcare workforce across the spectrum of experience levels. After this meeting, we will be sending out a survey monkey for feedback on how to improve these meetings. If you have questions throughout the presentation, you may write your questions on the sidebar, and we will go over as many as time permits. Before I begin, I would like to mention an opportunity in developmental medicine. Baylor College of Medicine is offering a one-year developmental fellowship starting July 1st, 2020. The fellowship aims to train med-peds, family or internal medicine physicians as leaders in the care of individuals with neurodevelopmental disabilities. We have the flyers that we can email to those who are interested. And now it gives me great pleasure to introduce our amazing speaker, Matilde Hernandez. Matilde is a graduate of Central University of Venezuela. She received both her dentist degree and specialization as a periodontist in Caracas, Venezuela. Matilde is currently a member of the Colgate Oral Pharmaceuticals Professional Relations Department and works as a public health manager in North America. Matilde is an active member of the International Association of Dental Research, American Dental Association, American Academy of Periodontology, and Hispanic Dental Association Foundation board member. Thank you for speaking today, Matilde.
Thank you, Rachel, for being my facilitator today of these virtual Grand Rounds. I'm excited to be here. This is my first time with the AADMD, and I'm honored of the invitation to share with you. So hello, everyone. Thanks for joining and taking the time for this discussion on how to making it easy to integrate oral health into what you will do. And this we will do through the Oral Health Prevention Primer. It is a campaign from the American Academy of Pediatrics, and that campaign is called Campaign for Dental Health, Life is Better with Teeth. So I have to disclose, I am Matilde Hernandez Gonzalez, and I have to disclose that I work for Colgate. So this is the story of my life in a snapshot. So yes, as Rachel mentioned, I was born, raised, did my dentistry and perio degree in Venezuela. And then I have moved, joined Colgate and moved to many countries. Today, I work for North America, so US, Canada, as Scientific Affairs and Public Health Manager. And again, a pleasure for me to be here with you in this virtual venue. Our topic today is about oral integration, and I would like to begin this discussion with a conversation about the opportunity for impact and the responsibility that all of us have as primary care providers when it comes to oral health. As we all know, oral health is critical to overall health, but as we are frequently reminded by, in my case, by kids presenting with oral health disease, there is significant progress to be made. Or as we say in the commercial world, there is a big opportunity on preventing the disease. Across the country, millions of people, especially poor and minority kids, suffer from dental problems. Problems that often lead to missed hours of school, work, and they're costly for the government, for the states, and involve treatment and sometimes life-threatening infections. And yes, life-threatening infection, it happens in the US. There is a famous case reported in a book, Teeth, about a kid from really close to Washington, D.C., that suffer an infection in in their teeth and was admitted to emergency several times, never get to see a dentist, and unfortunately died from complications. The good news is that everyone in this virtual room is uniquely positioned as a steward for preventing unnecessary disease. Caries, periodontal disease, those the most common in the oral world, are prevented. And if we promote oral health for children and for the family, and we take this as our responsibility for improving overall health of children, by definition, is what pediatricians, primary care, and dentists do. We have the opportunity to improve access to care. We know that the children will see a physician, so Rachel, my moderator, they will see a physician up to 12 times before they see a dentist, particular in the first 3 years of their lives. And these disparities are even bigger among the lower income families. Children are really less likely to visit a dentist if they are Hispanic, if they are African American, if they are American Indian. And that should change. We, again, early childhood is completely preventable, and prevention starts with each one of us. Currently, more than 40% of kids will have tooth decay by the time they reach kindergarten. And this is a reality for US, for Canada, and unfortunately across the world. Um, as primary care providers, again, we have reasons, and most importantly, we want to prevent the suffering and the pain of those families that already have and face many barriers to access dental care, especially families with low income. But these barriers and ultimately the health, social, and economic impact that result from them can be alleviated if we integrate the whole idea from AADMD. That is not dental working in silos with the medical, but it is a space for collaborate or for collaboration with key stakeholders. So let's think about the many possible partners. And probably many of us are already here. We all play a vital role in the oral health disease prevention, the public health sectors, the school programs, and as Colgate, we do have a big school program that has been there for more than 7 years, reaching millions of kids in the US. But there is also opportunities to include the OBGYNs, the family doctors, the nurse practitioners, also dentists and dental hygienists. Pediatricians play an important role, and the best example is that this toolkit was put together throughout the American Academy of Pediatrics. The more and more collaboration across these sectors, we can help increase that standard of care that is vital for care and access to the families. In this webpage, you can see I like my teeth. Uh, and the work have already begun, probably even by you in this virtual room. You have been part of these efforts through ADMD, or you have worked with a primary care provider to support oral care integration as part of your day-to-day. So this specifically is the campaign for dental health that was developed by the American Academy of Pediatrics. And it is presented as a hub in a new resource called the Oral Health Prevention Primer. This is designed to help any health professional, pediatricians, dentists, any health professional to address oral health in their practice. They give recommendations on the roles, on the oral health allies, and and of course, how to learn to collaborate and advocate to achieve optimal oral health. In today's presentation, we're going to go over some of the key elements that make this tool so unique, and I hope that you can leverage and discuss so that this presentation do not stay here, but you commented with your peers, you commented with pediatricians, you commented with any healthcare provider so they can incorporate some of these resources featured in this website in their ongoing work. But before that, I will ask Rachel's help and get your feedback to get how many of you, just a quick poll of the room, how many of you would say that you are already doing something for oral health promotion and disease prevention? Into your visits, into your schools, what are you doing? And please write in the chat um, right here, and Rachel will help me compile those answers. So please let me know. You could be performing a risk assessment, applying fluoride varnish, or just referring to a dental home. Anything related to oral health that you think you're currently doing, just for me to have an idea. And for that, I will give 15 more seconds. Let me know, Rachel, if somebody posted
Okay.
anything. No? No, no participation?
I see a few
Okay.
people raising their hands. David Kroll said in education of residents. We have
Thank
risk
you, David.
assessment and fluoride varnish application and referral.
Okay, so thank you. Thank you for the ones participating. So many of you are doing already some work in the area. And as we start to explore this tool, you will discover that is specifically made to uh, prepare to meet your needs. So you can just be doing nothing and you want to start, or those of you that are beginning, or those of you that are advanced in this work can take a deeper dive into this oral health prevention primer as a setup. Well, as you can see, there are 10 topic areas. These 10 topic areas serves as an entryway of a topic of your choosing. So each one of these areas will be broken down with additional orientation and topics overview on what does that contains. Some of the resources that have been there have been flagged by the American Academy of Pediatrics as recommended. So if you are started from zero, or you are just at the surface, I would highly recommend that you review the ones highlighted by AAP, that they are usually in color blue, to start. So one of the great benefits of this tool is that offers a tailored discovery. As I mentioned earlier, no matter how much you are currently integrating into your patient care, into your community care, you just have to choose what action area are you most interested in. What are you looking for? This range from lighter lift action areas like assessing caries risk or applying fluoride varnish to more involved topics like advocating for patients and policies. You can choose to dive into any of the ones you want to engage first, but there are deeper customization options once you get into each topic. For example, if you are interested, and I highlighted here, the collaboration, you can collaborate with others in your area. Once you're there, you can take a step further and refine who are you looking to collaborate, and so on. Are you interested in engaging with other healthcare professionals or practitioners different than you, or you can toggle across all those options um, without ever leaving the page. You can just, it's really easy navigation, so you can tailor to your needs. Another important element of the toolkit is that it's very action oriented. Once you've identified what area do you want to actionate, you will be connected with practical resources. For example, um, um, you may already integrate oral health work into your practice. So let's say you are ready to take the next step and get paid by the oral health services because you are already applying varnish, but you are not charging. Well, one of the resources that you will find under that a specific area of action is a coding fact sheet for primary care physicians, for example, that is available for the AAP, and that gives you the codes and what type of reimbursement you get. Or let's say in the second pillar that you are interested in educating families, you will find an entire suite of print digital materials to use in your practice and with your patients. For example, one of them is the one displayed here. It's called the Tiny Teeth Provider Toolkit. And Tiny Kit offers posters, animated videos, infographics that can be easily adaptable in more than 9 languages to use in your communities. Lastly, the third example I put here on how action-oriented it is you are interested in innovating with emerging models. The example for that is from MDI Colorado. It is a readiness assessment for the medical dental integration. This tool includes recommended budgets, surveys, questionnaires, and interactive assessment to guide you through initiating a successful project. So again, no matter what topic you are most interested in, you will find a variety of resources. And I forgot to mention that please, if you have any questions as I am presenting, Rachel is monitoring the chat. Please raise your hand. Uh, Stop me to make any question that that you want to ask. Finally, the oral health prevention helps you amplify your impact. It's designed for you, for primary healthcare providers and other stakeholders to amplify your current impact. Many of you, the ones that are already starting, you can expand your current efforts. We already covered some of the tools available to help you pay your service, to help educate families. But one that I highly recommend is the provider-oriented modules for those of you who are not dentists, that is being offered through the Children's Oral Health at the AAP, that they recommend the Smiles for Life oral health curriculum. Or maybe you would like to know how to start from zero and integrate actual dental services like caries risk assessment and get paid again uh, uh, on health services. You will find those resources here to connect with a number of methods for medical dental integrations, resources to help you assess your practice or what you are doing. Even as a student, you can start thinking on new models to integrate your school to a national, state-based, or rural model access that focus on recommended white papers on this aspect. So it's all there. Highly recommend the impact. Um, Instead, you are ready to teach other providers. And I think I heard that someone was already speaking to other residents, and that's a way to implement and to amplify the impact. So how can you take these resources and teach other providers, your friends? No matter which integration method you choose, innovative, implementing quality improvement projects, as long as you expand what you're already doing or start, is a big advance. Before we finish, I wanted to show the 10 topics that interface and give you access to the tool when you arrive for the first time at the oral health prevention primer. Um, um, Again, you can review each one of these 10 contents, but each one of those 10, let's say, actions are crucial to start advocating. And once you start diving in this topic area, you will find the resources and titles for each. This is how it looks on the implementation tools, and each resource offers a quick description. So you can choose and and recommend designations to help you prioritize if needed. And as mentioned at the beginning, if you are started, there are designated, like highlighted in blue with a star, those uh, places of those resources that are highlighted as the best standard in the area. So everything you need to know to start navigating an easy use. I will stop again to ask how many of you feel comfortable expanding. So if you are dental, reaching out to medical; if you are medical, reaching out to dental or any other healthcare provider. So I will take another quick poll of the room. After being introduced to this tool, I'm curious of whether you're feeling that this could be a tool for you. Just please raise your hand and share any idea of the intention that you would like to have, that you would like to expand your or if there are so far any takeaways from this audience. So I will let another 30 seconds and listen from Rachel that could help me again, please. Rachel, anything? Did we got any interest?
I don't see any questions posted yet.
Okay. So thank you. And again, I like myteeth.org is the website that offers these tools. And now I will go through some slides about specifically special needs and ability. As Colgate, we did sponsor the presented tool, what I just showed you. But we have started to take action on our own. For this target, we call it the special needs or special abilities. And thanks again to AIDMD to allow me to present also what's up with Colgate. What is Colgate doing? So again, we are proud sponsors of the prevention toolkit with the American Academy of Pediatrics, and we think it's a great tool for you to start taking action. Now, I don't have to share a lot about the definition of disability, but it's usually associated with impairment, activity limitations, participation restrictions. What we see as Colgate is that 15% of the world population has a disability, and that represents an opportunity. It's actually an ability. Yes, cognitive and physical limitations make daily oral care routines a challenge, and dental visits even more. This population, over 1 billion people worldwide, are more likely to have untreated caries and decayed teeth. It is a loyal community that demonstrates commitment to inclusion, but we didn't see any company providing solutions to this community. This is the market opportunity, more than 6.3 millions in North America, but they are not alone. They are usually a people supporting in their network. And that could be a market business. So yes, I'm scientific affairs, but I also work on the marketing and innovation side of the company. So it is a market that we want to treat because Colgate believes that everyone deserves a future they can smile about. And it is highly engaged and loyal and emotional person that if you take care, they will respond back. They are we are always looking for new ways to support and looking for expert advice from the communities we work with, like AADMD, AAP, and any association of a special care dentistry, for example. Again, brushing is still a big challenge, and well, visiting a dental office is a nightmare. What have we done so far? The first that I can share with you is that we have partnered with Magnus Cards. Magnus Cards what founded was founded by Nadia Hamilton, this lady here in the photo, who had a brother, Troy, with autism. So she used to draw every step of his day, on from getting dressed to brushing to going to take a bus. And she decided, hey, Colgate, what if you support, we have grants, we offer grants for businesses. And she came with this idea of, why don't you support a step-by-step guidance with these drawings that I'm used to do for my brother, but in an app to help people with cognitive disabilities. And we said yes. So it was an app. The app name is called Magnus Cards. Is for life skills guidance. Is accessible with image, text, and audio instructions. It is available in 3 languages. So for Canada and US, which is English, French, and Spanish. It has an animated character reinforcing the skills, and the patients can create their own card desk. It is free, downloadable from Apple and Android stores. And again, it exactly builds on the opportunity of building a connection with people that need that guidance, reinforces daily interactions, and create a lifelong customer. As you can see, there are 12 categories because it's not only oral care, it's also grocery shopping, it's also how to make friends, it's also how to go to the bank, that we have developed. So it is really a holistic approach in an image resources to help these patients. And as mentioned, they can create their own. Some of the partners that started this project with Colgate, Colgate is the exclusive sponsor for oral care, but the bank and making purchases and going to the airport were a sponsor for other uh, people. So how does it work? The parent downloads the app, um, and the parent shows to the kids how to brush. And again, you build a routine. If you have a specific task that you want to comply, for example, taking a medicine, you can also put it there and create a card of your own. The child grows using the guide, using their routines or creating of their own. And in the case of oral health is really a memorable positive experience from the parent and the child, creating great habits in oral care, which is finally what will solve the problem of oral health. So we have done, since this project was launched in 2017, a comprehensive engagement plan with the communities that needed the most. So with the special needs organizations and partners. And today we have more than 12,000 users. We also have, as we know that today people are limited with their time, uh, our Colgate Oral Health Network podcast series. And these are three of the examples on tips for implementing a special care dentistry into your daily practice. Again, here the target is mostly dentists and dental hygienists. This was in partnership with ATSU, a dental university. And I love to quote, even though I did not include it in the photo, is a quote from one of the tips that calls about respect, kindness, compassion, and empathy, that without understanding the person fully, the person that you are treating, you cannot properly treat them as the person they truly are. So I really love that recommendation from the tip. And these are 15 minutes, and this provides CE credits. So dentists and dental hygienists have to take CE credits to keep their license. And this is I would say, a fun, short way on how they can do so. Another initiative, and more than an initiative, this is a coalition aiming to enhance wellness for people with disabilities, the project Accessible Oral Health. Again, we are sponsors of project, we Colgate are sponsors of project Accessible Oral Health, and we are working towards a better future for people with special needs. Another resource that I wanted to provide is the Colgate 2-minute tales. Colgate 2-minute tales, and you can Google it, is images for the hearing impaired. It's stories in 2 minutes, following on the trend that you only need, you have s- small period of time to connect with the audience, um, that are recommended before going into bed. We have also sponsored the campaign Brush Book Bed for the kids to incorporate oral health into their daily routine. Colgate 2 Minutes Tale, that it was produced in the UK with beautiful stories on oral care using artificial intelligence and an avatar, are really a fun way to engage with kids and again lead them to better oral health. Um, as I mentioned, each one of us can take actions. And even though when we did not develop this product, which is our new Colgate Magic toothbrush, um, for the special needs community, we have received tons of feedback that the augmented reality adventures engages kids in a next level generation. This is not available in any store. This is only available through our webpage, shop.colgate.com. And what basically does is it has several stories, and the kids with an iPhone, an iPad, and any smartphone basically can engage and see themselves in a stories that transport them to other world. So again, it was not developed only for the special needs, but we have received raving reviews from specialists that treat people with special needs, as they have managed to modify behavior in a very positive way. This is Colgate magic. Again, we know other companies have found success. One example is OXO. And again, the owner of this company noticed that his wife was having trouble holding and created this special, you know, um, holding for their pillars. And today is a multi-million dollar. There are products across multiple areas of the home, and products have won numerous designs, because if it works for a person with arthritis, it again, it makes life easier for everyone. So that's why we do believe that uh, focusing on people with special needs gives you special abilities. Another examples is also how the dimensions that the brands have positioned themselves. And this is a soap that uh, explores how their senses of touch have become so important for people with visual disabilities. Or the first Gerber baby with Down syndrome. Uh, the contest started in 2010, but it was actually the 2018 Gerber baby, Lucas Warren. With that, I I just want to see that we are continuously exploring the possibilities, and I'm proud to announce that we just supported Penn University with an amount of money to create or to establish an innovation lab that will definitely look in a unique collaboration with the dental community to serve uh, the community, or the special needs. With that, I will pause for question because I'm conscious of the time. So it's been 40 minutes. And I'm here to answer any questions, any comments you have from the presentation. And thank you. This is my contact, and also the contact on the American Academy of Pediatric information for you to follow up if you are interested in any of those tools. And with that, I will open, Rachel, if there are any questions, any comments, any suggestions, any ideas.
Thank you so much, Matilda.
And
That was a wonderful presentation. We'll wait a minute for people to type any questions in the question bar.
perfect. Yep. Yep. I would say everything is crystal clear. So thank you so much, everyone, for participating in today's discussion. I like to close by saying that we, as primary care providers and oral health stakeholders, play a critical role when it comes to preventing dental disease and integrating, collaborating, So we all have unique access to kids and vulnerable families. So we are really perfectly positioned, you from the AADMD, the new generation, to drive prevention of unnecessary pain and suffering from dental disease. So thank you very much.
Thank you, Matilde. It was a really interesting talk. Thank you for your time.
Thank you.